House tonight, although there are no confirmed cases of the new deadly strain of coronavirus in South Carolina, officials aren't taking it lightly. DHEC held a press conference this afternoon about how the state is preparing if the disease comes here. They say symptoms are fever, cough, and difficulty breathing, much like the symptoms of the flu.
Fox Carolina's Kayla Conboy live for us this evening. So, Kayla, what did DHEC say during this, and are they monitoring this virus right now?
That's right. They are monitoring and they are preparing. Right now, they are encouraging everyone to get the flu shot just because those symptoms are so similar. They're also working directly with the CDC to monitor all of this, saying they really don't want this to spread. So they're looking at the risk of this virus spreading in the future. The coronavirus is shocking the world with how fast it's spreading. There have been confirmed cases in dozens of countries, including 5 here in the United States.
When infection in humans occurs, this usually results in a respiratory illness that has symptoms very similar to influenza. It can result in more serious diseases such as pneumonia, or it can be very mild.
So far, there have been no confirmed cases in North or South Carolina, but health officials aren't taking the virus lightly, saying it all started from exposure to infected animals in Wuhan, China.
CDC is assuring the entry screening of passengers who have been in Wuhan within the past 14 days at 5 major U.S. airports in Atlanta, Chicago, Los Angeles, New York City, and San Francisco.
Travel to Wuhan has been shut down, and DHEC says the number of those potentially exposed to the coronavirus is dropping.
There's no specific treatment for the virus at this time. Treatment is supportive care. There's no vaccine that's been developed at this time.
DHEC officials say healthcare providers are the most at risk for exposure, so they're working on prevention. But they say they are still learning more about the virus.
We know that this is a respiratory illness, and we know that respiratory illnesses are spread by respiratory droplets that are coughed or sneezed out by individuals who are ill. And we know how to prevent exposure to respiratory droplets. That's one of the prevention measures.
Aside from monitoring travel, there's not much they can do, but they are recommending everyone get the flu shot to help rule out confusion.
Wash your hands frequently, cover your cough, and dispose of tissues and other items that are potentially contaminated with respiratory droplets promptly.
Now, we did hear from some hospitals, including Prisma Health here, and they have begun asking patients about their recent travels. DHEC says at this point it's best to be aware and precautious, saying that the death rate here is pretty low, between 2 and 4%. So they really are just encouraging everyone to get that flu shot and to wash your hands as much as possible. Reporting live, Kayla Conboy, Fox Carolina, the 10 o'clock news.
Kayla,